for joining us tonight for our live virtual event. I'm Dr. Newman, a board-certified plastic surgeon.
And I'm Z. Newman, Physician Associate at Newman Plastic Surgery.
We're excited tonight to talk to you about a new product to our practice, the RHA collection of fillers. This designer filler represents the latest advancement in hyaluronic acid technology to more closely resemble the natural HA in the skin. Now we have a tool that provides both flexibility and strength.
Now RHA aligns with our balanced beauty approach with 3 different formulations. We are able to customize your treatment from deep structural support to soften corrections that allow you to move and smooth.
Sounds nice. Now we've put together a live demonstration. No, we haven't. We've put together a video demonstration using the RHA collection of fillers for the full balanced beauty treatment. Please stay tuned. Afterwards, get this one, live Q&A session. And feel free to submit questions along the way through the questions tab.
Now tonight's event attendees will receive exclusive promotions and discounts on all lasers and skincare products, as well as progressive discounts on all RHA filler treatments. So today we are talking about the RHA family of designer fillers, and we have our beautiful patient Jacqueline, and today we're just going to do a little bit of airbrushing. So she has great structure in general, and so we're just basically augmenting some of her features, allowing for more or less for her to stay maintained and look very natural and beautiful in motion. So let's go ahead and start kind of our assessment here. So if we're looking at Jacqueline, I'm going to turn your head this way. Naturally, everyone has a little bit of asymmetry, and so when we're younger and our skeletal structure does allow for those things to be balanced out, but it's covered with soft tissue and with volume. And so with time, we may make little adjustments here just to maintain that balance, and I think that's going to be important here. So even just at a baseline, as beautiful as she is, there are little tiny changes that we can see. If I were to split her face in the middle here, this side is a little bit wider and a tiny little bit lower compared to this side over here. And so with that, we're going to do little adjustments to just bring this back up to be softer and more equal to her left side over here. Bringing up the brow, and also go ahead and smile for me. So she naturally pulls back just a touch here, and so by adding a little bit of volume right there, we'll be able to bring this back more equal as well. So we're just, like I said, we're going to soften both sides. We're also going to add a little bit of hydration to the lip area, just to get a nice soft line. We don't have to have really big lips. She's got beautiful lips. We're just going to redefine them a little bit more and hydrate them. Okay, good. So we are going to start with actually a little bit of a lift over here of the temple that's going to bring this lateral brow up just a touch. So one here, just do the 1 1. When injecting, we always want to make sure we're staying safe. So I'm in a good plane right now, right on the bone. Pulling back a little bit, making sure that we're, exactly where we need to be and nowhere we don't want to be. And that just gives a little bit of a powerful lift right there. You bring that lateral brow up too. As we get older, we tend to lose volume all over. One of the places that people don't tend to notice a whole lot is in that temple. And the problem with losing volume in the temple is that they'll start to notice that their eyelid starts to fall a little bit, and some of that's actually because of the lack of support on that side. So if we go a little bit deeper, we're able to give that support, and everything else kind of moves over. Some weird noises. And just little aliquots. So we're not talking about a lot of volume here, but each little bit does a fantastic job. And what's nice about the RHA fillers is that it almost kind of umbrellas the skin a little bit and brings it up, as opposed to being more of like a firm ball or anything like that. Like that's some of the other fillers have had some issues with. But this actually helps to suspend the tissue better. Now we're doing a more powerful spot over in the lateral cheek, also giving some lift It's one of my favorite spots to inject, simply because it helps not only the cheek area, but it actually helps to support this entire part of the mid face, so that you actually get, you know, lifting here, and it also can affect down here where people say that they will start feeling that they're getting jowls. Jowls is not an issue that Jacqueline has, but you know. Once again, these injections are deep onto the bone because we're trying to mimic the bony support that we have that helps hold up that youthful tissue. And that's why you really don't see it very much, as far as nothing underneath the skin, because it is so soft underneath that tissue, but over the bone. So it's that deep suspension that's there. Okay, another powerful spot that I really like to inject is over here on the side of the nose, like the little piriform aperture. There's important vasculature that's here, so we want to go to a safe plane once again, which I go deep to the periosteum. And we'll reflex as well, and that's what's going to give this a little bit more lift in that area without going directly into that fold. You know, a while back, people were very concerned about, you know, I've got these laugh lines, they're, you know, I need to get rid of them. And so people, instead of looking at, you know, the cause of them, they were just seeing a line and chasing it. And the issue that comes up when we do that is then it starts to look very unnatural, and people were actually looking too full there and would almost have like no delineation between like where their smile was and their upper lip ended. It would almost look like blocky, or in some instances they would call almost like a simian type of look too, which is not as attractive. I mean, laugh lines, like there should be some natural transition that's here just so that, you know, we can show expression. Sometimes when injecting this spot, we can get almost, because there is actually some lidocaine in the filler itself, which helps with the tolerability of it. But sometimes people can feel a little bit of numbness because they're feeling the lidocaine in the filler itself. That will go away in like the next couple hours or so. Beautiful. Now, how are you feeling, Jacqueline? Are you uncomfortable at all? Like, are you?
I'm not.
Good. So all we did for her was put some, you know, topical anesthetic on. We let that sit for a little bit just to make sure that this is as comfortable as it can be. And typically, you know, people don't have too much discomfort with doing the fillers.
Well, and if I may add, it helps when you trust the doctor. So, I trust you.
Well, I appreciate that too. But as we were saying earlier, like, communication is really, really important, whether, you know, I've done this like one time versus like 40.
Mm-hmm.
You know, we always want to make sure that we're staying safe and that, you know, the patient feels comfortable, like just expressing any thoughts that they would have to. Now, you know, all of us, you know, sometimes get headaches and take anti-inflammatories. Anti-inflammatories can sometimes cause a little bit of oozing or a little leakiness, but if possible, we have people avoid taking those about a week ahead of time, just so that, you know, we can avoid, you know, any bruising that's there. And with this, the needles that we use, or even the cannulas that we use, are tiny. But anytime we inject into the tissue, there's always that risk of bruising. But we hold pressure and we go ahead and, you know, put some ice on it and get that under control. And afterwards, I mean, when I pull the needle out, a lot of times I'll kind of massage over the area and palpate it. And what this does, it makes sure that the product is laying nice and smooth for us. Because, you know, anything that we do underneath, like, she may feel. And so we want to make sure that's as soft as possible. All right, good. So we're about to do the lips. And with that, remember, we had just some natural asymmetries of the skeletal structure itself. But what that does, it will lead to little changes and differences in the soft tissue. And one of those areas is the lip. If you'll look closely, actually, because we were able to add volume right here to the piriform, it allowed for her lips to be a little bit more symmetric. Before, this one kind of pulled back a little bit more and was a little bit more elongated, but now their heights are much more closely matching and more symmetric than they were before. So now we're really just adding soft hydration and just a little bit of definition to the lips. Okay? All right. So the product I'm using now is RHA 2, which I really like for hydration. I'm actually going to go ahead and have Phoebe here, my assistant, use a little distractor. It makes things a little bit more comfortable for them. So this product is really soft and smooth. And we did put some topical on the area, but the lips are just a more tender spot. You know, some people prefer to do blocks to allow for numbness of this area. The downside I see for that in our practice is that I really like to make sure that I can see how they smile and how the product is kind of laying on their teeth when they smile. Make sure there's nothing that's inconsistent that's there. So if I get them too numb, then they're not able to give us that dynamic motion. And that's one of the benefits of the RHA products, is that it is that flawless in motion type of product where it's made for motion. It's that softness that's there that keeps things looking really natural. Go ahead and keep on looking. Thank you. If we look real closely, you can see that, you know, she's got just softer definition of the lip itself here and that volume that's there. And now we're going to go to the other side. Like I said, just to softly augment that area. Okay. You're doing great. Just a little spot here. I'm just trying to define little focal columns for her. Sometimes with time, those get a little bit softer and we don't get to see them as much. All right, smile for me. Good, relax. Make sure to squeeze. Both nice and soft. We're going to do some jawline now, and so it really is just to soften this area, and whenever she smiles, go ahead and smile for me. There's a little bit of depth that's there, and we're just going to softly correct that so it doesn't have that little fingerprint that's there. Okay, relax. So we prep the skin, and this is how we do the cannula technique. Where I'm going to go ahead and do a little entry point here. So here we're using that RHA 2 product, which, because she's got, you know, just very minimal areas that we need to correct, we don't need anything thicker. This just helps softly transition the spot for her here and right underneath that chin area in the corner of the mouth also. So I can kind of reach all these different spots with the cannula. This allows for us to minimize bruising and get the product where we need it to go to. You can see that the end of the cannula is actually way over here, even though our injection points are back this direction. And that just helps us once again so that we don't have to do multiple sticks using cannula. Also, because it's blunt tipped as opposed to being sharp, I can go into different areas and not worry about going into muscles or going into blood vessels. I apologize. Keeping it nice and safe, and once again minimizing bruising. So now we're easing those transitions and softening those lines. Once again, this is using a cannula. One of the areas that we're also going to address is, remember, this is her naturally fuller side, and so she has nice transition to her ear here. The skin is nice and taut and it pulls back well. This one, just slightly, even though we've already helped with the height of the cheek here, it does kind of fall just a little bit, and we start seeing some of these little lines that are here. Suspension of the tissue back towards the ear here actually will allow for this to continue to give her more of a lift. That's going to last a little bit longer for her as well. So I'm going to start first with just a spot right on the bone here. Once again, pulling back to make sure we're safe. Perfect. It helps to hold this jawline back. This product that we're using now is the RHA 3, which is that mid-level type of filler from this collection. Gives a little bit of support, lots of flexibility, but it's, you know, it's good for, you know, where she is and her type of skin that she has as well. If she was very thin back here, we may even consider using the 2, just so that we wouldn't see it as much. But because she's got great overlying tissue, that's the product of choice here. So now we're going to address, like, you know, the lateral portion of the eye here, and that's just going to help to soften up that suspension here, so it evens out with this side a little bit more. It helps also with some of those fine lines that are there. And we use, of course, a soft product like RHA 2. And out here, you know, with oftentimes people that are very animated, they laugh a lot, then they can get soft little lines that are out here. By adding volume out in this area, will actually, that tissue can be more smooth even with laughing and motion of it. So one of those added bonuses too. I like to use cannula in this area especially, simply because it does help keep us a little bit more safe. Blood vessels are kind of superficial here as well, so this keeps us in a really good plane so that it minimizes bruising.
See, how long does the swelling last?
Swelling, just for different areas, can change a little bit. Like the lips, like they'll swell a little bit more tonight, and then tomorrow they may even swell just a touch more. You know, swelling is always relative, but anything you do in the lips will swell. That usually goes away and kind of normalizes out in about a week or so. Otherwise, you know, like facial swelling, things like that, usually resolves in about, you know, less than a week. Everyone's a little bit different. If you have taken any anti-inflammatory, sometimes that causes that swelling to be a little bit more prolonged as well. And one of the things is that when we do correct this under eye area, I prefer to be a little bit more on the conservative side, simply because the tissue has to be, it has to get used to having product that's doing some of the work for it. And if for some reason, like, you have seasonal allergies, or you have just natural swelling in the morning, anything like that, like, you know, we want to give the body some time to adjust, being allowed to adjust. And if we need to add more, then we can. We just don't want to do too much at one time regardless. But I think it's nice for us to be able to keep everything in balance, and by treating multiple areas at one time, it actually looks more natural, as opposed to, you know, if there's multiple concerns, and, you know, it allows for us to have different areas all moving together, so that anti-ages and rejuvenates in a cycle together. Ready to see?
Yes. Oh my gosh, I love it.
So once again, we lifted the brow here with just that temple correction, and then we softly suspended the cheeks again. This side, we made you a little bit more symmetric, just by, once again, bringing a little bit more volume up here, increase the cheek structure there. I also did a little bit in the preauricular area to help suspend that tissue and make that nice and smooth this way. Did some jawline softening, as well as these beautiful soft lips too. So,
wow, very excited. Thank you.
You're welcome.
Hi, everyone. Please just be patient. They are having a couple of technical difficulties, but we'll be here to answer your questions shortly.
Okay, I think maybe we're on. All right. Okay, good.
Says who? Is this working?
Hot mic.
Oh, are we on?
So we're on.
Hello, everybody.
All right. All right, so we're on now, right? We're good? All right, perfect. So thank you all for joining us tonight. We really appreciate you just taking the time out this evening to join us for our virtual event. We go ahead and get started with some questions. So
What do you want to talk about?
I know.
Let's see what you guys want to talk about. I got a
See.
few questions here. Let me look at some of these. So again, we're talking about RHA. And I got a question here for you.
Okay, go on.
Do the injections hurt more than Botox injections?
Well, Botox injections are different. These are fillers, and so therefore they're going into the deeper planes. And so a lot of times we'll prepare the patient a little bit differently. So we will usually use some topical numbing for them. And then because we are injecting into different areas, the topical will allow for you not to feel that pinch so much. Sometimes you can feel a little bit going into the tissue, but at the same time doesn't tend to hurt very much. Patients are very comfortable throughout the procedure. For some of our friends and patients that are a little bit more uncomfortable or anxious, we can even offer Pronox gas, which allows for the experience to be much more comfortable for them as well.
So to sum up, do the injections hurt? The answer is no. Jacqueline did very, very well. Our test patient there that we showed you the video, she did very, very well. Again, a little bit of topical if you need it, it's good. Certainly, I would say if you got some in the cheeks or the temples, that's not going to be as sensitive as doing it around the lips. And so that's where you might want some topical around the lips, but not necessarily in other parts of the face. Okay. Thank you very much for that one. All right. Next was going to ask about numbing. So she already touched on this a little bit, but maybe it's worth going into again as far as topical anesthesia. It's not local anesthesia like you would get at the dentist, for example, where they would put a needle in you to numb you, but just a little topical sometimes can take off some of that, some of the bite out of that. And we typically would use that around the lips if you've requested, or we can offer it to you. Other things we do to sort of lessen, and that was in the video as well, is little diversion things, little vibrating things that makes you feel the vibrating, and so it sort of distracts your brain into thinking that you're only feeling something vibrating. You're not really feeling the sting of the injection with that. And then the other thing we do is we like to chill the areas too. So we usually have an assistant that sits there with a little iced air, and then they're blowing that on you, and that tends to help you feel better again as well. But do you have anything to add to that?
No, that pretty much covers it. So with this, one of the questions is about, whether or not people will have like a natural looking result. So one of the things that I do think that we've found, especially with the RHA fillers, is that we've incorporated it because it is specifically developed so that it works with motion. So we were able to have different levels that we can treat patients with. The RHA fillers, once again, like the 4 is a little bit more for structural type of correction, but it also knows how to move with the body too. The 3 is kind of our workhorse, and the 2 is one where it's made for softer areas. And so what's nice is that with this profile, we're able to treat the face globally and have it look very natural in dynamic motion. So you're not just looking good in a picture static, or just when you're smiling static, but actually when you're moving. So when you're sitting across from your friends at lunch or having a cocktail, like they're looking at how refreshed you look and how soft things are, not what's coming, they're not looking right across you being like, what's in your face? So that's always like what people are concerned about, is unnatural results. And because it's got this balance of stretch and strength, all those areas, it's specifically made for that, which is why it works so well in so many different patients, because we can customize it for you too. All right.
Exactly what she said. More natural.
So we have.
Hold on. I'm going through
We
here.
got a lot of questions, so we're going to go through them for us.
Is this product reversible like traditional fillers?
Traditional fillers that are hyaluronic acids are reversible. Like the RHA actually stands for resilient, which once again it talks about how resilient it is when you're in that fourth type of dimension of dynamics, but it's resilient hyaluronic acid. So yes, if there's a reason that we need to reverse or even settle down some of the filler, we can. Honestly, that's not typically a problem we have in our practice as far as needing to reverse the results that we get from filler treatments. But if it's something that is a problem or a concern, then yes, they can be reversed with just some hyaluronidase injections.
Yes. So again, but another question would be, so how about reversing this versus maybe some of their competitors? Would you see that you would reverse this as much, less, or more?
Well, in the past, I think that what we have found is that some of the fillers are more solid or stiff, and so there's more of a desire to have them reversed. One of the things that we do in our practice is that we end up fixing other results from different practices, which is, and different people have different approaches and different aesthetics, but at the same time, if a patient's not happy or has an issue or has something where it appears differently than what would be ideal, then we have the ability to reverse it. And this, because it doesn't have as many of the chains and it moves with the tissue, like reversing this is not as much of a problem for us.
Got it. Thank you. So we also have a question here. So tell me about how long does this product last? Does it last longer? Does it last as much, or does it last less than, say, the question was about Voluma?
Right. So in the studies, what they have found is that RHA lasts about 15 months, which is pretty consistent. A lot of times we'll see studies where things are lasting 2 years. Well, in some of those studies, you're using 6 mLs of product to get that correction. This is used in these studies that they've shown with the RHA giving the 15-month results. It's actually, with a 15-month duration, you're maintaining that correction and not having to use as much product to gain that. So it's not, you're just continually stacking. So instead of having 6 cc's, you're using closer to 2, and you're maintaining those results. But once again, I will say that depending on where you're starting from, and where your endpoint, where you want it to be, that actually determines your number of syringes that you would use globally. And what's great about what we were able to demonstrate with this video was that we did a global correction, and it was when everything is kind of moving together and we're addressing structural changes. What's happening is that you're anti-aging all around. Because there are different dimensions that we are aging, and even though we're running parallel tracks, we're able to reestablish, and that's why we were talking about airbrushing with Jacqueline. It's just, where time has adjusted things a little bit, we're reestablishing structural change, where we're resupporting the volume so that she looks natural. She doesn't look like she's done, and we can almost stop time a little bit too, which is a nice benefit.
Yay. We think so. Next one. Get your glass ready. You ready?
Yep.
How does RHA product compare price-wise to other fillers?
This question is actually specifically to Voluma, and price-wise, it compares very closely to Voluma in that it's 850 syringe, but with that, you're getting 15 months duration. So with that, we have premium fillers. It's not just what the effect of it is, which is also important, but it's also the duration of the filler itself. when we're having promotions like such as we have today for this event, because we're able to do multiple corrections, like where you're getting your value is the duration and time, because all of us are living busy lives. At the end of the day, like we're making time out so that we can make these appointments, and we want to make sure that you don't have to be running in all the time to getting these little touch-ups here and there. You're being able to maintain those results. And so the value is in not only the correction, the feel of it, but it's also maintaining the look and not having to keep on coming in too. And someone else had asked about, I believe the question was, how often do I have to come in? And that once again addresses that, the duration of the product itself. So it's 15 months.
How does the RHA product feel in the lip?
Okay, so when we're injecting into the lip area, keep in mind, just feel your lip right now and how soft that is. So when the skin is very thin, you may initially feel it a little bit more. But what's so great about it, because it's specifically designed to behave like your own natural hyaluronic acid, that once it incorporates into the tissue and really softens up, which is only about a week or so, it will actually, you won't really feel it so much anymore, because it's made to act like your own hyaluronic acid, more so than any other filler that's been out in the market previously. And so you won't feel it as much because it becomes more like you.
Good.
So, okay.
Okay.
All right. Let's look for some more fun questions.
I got this one. I get to talk some now too.
Okay.
Does getting fillers keep me from having to get a facelift?
Yes, plastic.
The short answer is no, but also yes. So why is it no? So you're going to need a facelift when you come in to see Z and you're tired with the jawline and the neck bands and the cheeks hollow and everything. Well, the fillers can't get you that far. Surgery is going to be required. But what we're finding with our filler patients is, instead of getting that first facelift at 50, 55, maybe you're getting it at 65. So it kind of pushes everything down the road a little bit, which is good. And a lot of patients come in for a facelift, and I say, not yet. Come back and see me in a few years. What you need is a little bit of volume. You have a little bit of jowling right there at the jawline, but if we put a little bit up here near the cheekbone underneath the zygoma, maybe you're going to get a little bit of a lift out of that. Certainly, when you're going to full correction, like Z was talking about, you're going to get more of a lift. And the more you can re-enhance that, you're going to be able to avoid getting that facelift. And today's facelifts, they're not the facelifts that your mother got. They're
not this.
You're not in a wind tunnel. What we're doing is trying to make everything more anatomic, and that's where this product has a nice niche for us, because it's making things more, you can animate with it. It's not just stuck. The old facelift is stuck, right? So we want you to be dynamic. We want you to be able to move. And this product is a nice combination with that, because part of the aging process is volume loss, and you need to restore that volume, or else the facelift's only going to get you so far. Facelifts deal with anatomy. It doesn't necessarily deal with volume. It doesn't deal with skincare. So we do all these things, and it's so great when someone comes in to see Z for fillers, and she goes, "Nope. Hey, Chad, come on in. Come on. Just talk to this lady for a little bit." And I talk, and then conversely, I get someone that comes in and wants a facelift, and I say, "Hey, Z, come on in here." And so we work well together. We have these sort of parallel practices, and there's a lot of overlap between the two. So again, fillers aren't going to keep you from needing a facelift, but it may make that facelift down the line. So you wouldn't have to get it so early, but you might still need it somewhere at some point in your life.
When some of those things have to do with structure, and once again, all of us are having, a certain starting point, and then what our goals are for an end point too. Some people aren't really looking to have surgery. I mean, they have kind of almost like a fear or anxiety of surgery as well. But at the end of the day, you know, we want a global result, and that's what's going to keep people actually looking younger and looking more natural. Because even with our facelifts, like we're doing a lot of volume, like when we're at it, we're adding volume during those times as well, so that people don't look so gaunt and hollowed out with just a facelift. They want, you know, you want to have that nice suspension of the tissue too. You know, there's a question about, you know, can it be used in the eye area? Absolutely. Like we can use fillers, you know, in the eye area, because what it does is that it reapproximates, you know, the tissue and gives it that support to this lower, the inferior orbit, as well as this lateral side. And so when this gets a little bit lower, less supported, the trough goes down, and so it looks like we have more of a bag. If someone has a true, you know, a true bag that's there, what I do is I try to transition and soften it a little bit more to give that support. But if they have that fat herniation that's there, that's when surgery has its own role too. So we can, there are non-surgical results that can make things transition nicely, but at some point in time, like, I mean, you know, surgery may be necessary depending on what's going on with that anatomy. And I think one of the benefits of coming to our practice is knowing that, you know, it's not like we have one hammer and so everything you see is a nail. We're able to say, you know what, that's resurfacing. That's going to be volume. That's going to be, you know, something that's going to require surgery because we have to actually remove tissue and skin.
I said the same thing, but it sounds so much better coming from
Yes,
you. So,
you know.
All right.
We have more skills.
All right. How does this product draw in water like traditional fillers? Everyone wants to know.
Right. Typically, there's not as much swelling actually, simply because of the way it's formulated. In some areas in particular, if you inject even an empty needle into a lip, it's going to swell. Like if you've ever bitten your lip, it'll swell. So with that, you know, it doesn't draw in water as much as, say, like the traditional Juvederms and Restylane, the higher cost type of fillers. It probably would be likened to similar to like Voluma and the Define Refine Expressan as far as drawing in some fluid, causing some swelling, but you know, in general, people don't have a lot of swelling with it. One of the exceptions is that the eye and tear trough area. For me, like in all honesty, like I prefer to be a little bit more conservative and rather would do almost a staged correction of the tear trough, simply because we have so many different elements that will come into play as far as how much water you will draw in. Because if you've got pollen, you know, making your allergies freak out, you know, or even just the delicate lymphatics that are in that area, we don't want to stress them too much. And so it's better to be more conservative and have a better natural result than overcorrect and then have to worry about backtracking. And, you know, patients are uncomfortable during that time too. So once again, I like just I saw someone today where we softened the area and gave her that structural support first, did a little bit of volume in the tear trough area, but then she's coming back in a couple of weeks so that we can just fine tune it as we need to. And she may not need anything, because as the filler does take in a little bit of water, it may be to where she's completely happy and doesn't want any more. So that's good. Good.
Yes. Does draw in some water.
Yes, it does draw some water.
Does cause a little bit of swelling.
Yes.
Okay. But not that much. I mean, day or two, you're good. All right. Good. Some of these are going to be repeats, but because you guys are kind of coming in and out, so we'll go, how long does it last? I think we talked about that earlier. We said about 15 months is good, and certainly you're going to get more longevity in more static areas, like in the cheek areas, temple areas, anywhere around the ear. You're going to get a little bit longer than a place that's constantly animating, like your mouth or your eyelid areas. But in particular around the mouth, it's not good. That's going to be closer to the 15-month mark. Okay, and that's a good thing or a bad thing, because if you know, if you like it, it's good for 15 months. And if you don't like it, it's only good for 15 months. It kind of depends on your perspective. Okay, good.
All right.
Hold on, I got it.
Someone's asking, what if a person already has fillers and spots? Can this work to minimize lumps and bumps that might be visible? So if they already have fillers in place, actually one of the benefits of the RHA filler is that you can inject it deep, but also in more superficial planes too, and it really does incorporate nicely into that tissue. So, and what we have found, and we've had this in our practice for a year, and it plays nice with others, and that's something that is actually a nice bonus as well, because as other things are receding a little bit, and maybe the results of previous filler or from somewhere else may be deteriorating a little bit, this can actually take over. So then you have a nice soft correction above it as well. So, you're able to be maintained. It's good.
I got one that's more of a comment than a question, but I have to read it out loud.
Oh boy. Do you?
It's for you.
Is it?
You did amazing. So fun watching you inject. We get a lot of these.
Yep.
Your voice is so soothing and you're so gentle. So
Yes.
you're going to get that too, okay? So you're going to come in, you're going to get her soothing voice, you're going to get her gentle bedside manner, and you're going to get the TLC that you want to have. So think about that too. All right, so let me get back to it. Okay, more questions. My goodness. Thank you all for doing this, by the way, and staying with us. We're going to wrap up here in a little bit because I know it's dinner time or time to put the kids to bed.
There was a question, how many syringes were used on Jacqueline? So for her full facial correction, we did use actually 6 syringes in different areas. And that, once again, we had used correction to raise her cheek and make her a little bit more symmetric. We had done a little bit of approximation in the tear trough area, not directly into the lower tear trough, but more lateral correction. I did some in the temple as well as in preauricular area to kind of bring back her jawline here and along her jawline in this direction as well, in that pre-jowl sulcus area and the lips. So, but at a baseline, once again, she had good volume, but we were fine tuning all these areas, and then now those results are going to last her, almost a year and a half, which is fantastic because now she doesn't have to worry about it.
Everyone has a budget with all this, and we recognize that, and we're trying to stretch that budget out as far as we can. And some patients, are going to be great with 2 syringes. Some maybe with 1. Maybe you come in and want to do full global correction, full face. You're going to be looking 6 to 8. And that's important to know that. Okay. So let me get to some other specifics here. I'm sorry.
But as he's going through questions, though, I'll also add to that a little bit, is that, if you don't want the full global correction, it's also like what bugs you. I mean, everyone's got their thing. And so it's like, today, I really want to address my eye area. I feel like I look more tired. Then we can just address that too. If you want, I feel like my lips aren't as hydrated, or they don't have the same shape that they used to. We do listen to what your concerns are. And so we just want to make sure that we were able to present something that, if we were to do this in an ideal situation, but you can pick and choose what really would make the most impact for you. And, in some people, it's the lower face. It's like, you're feeling that, I look sad or I look like I'm scowling when I'm not actually. And what we're finding is, especially with these Zoom meetings, the lower face has been a much bigger area of concern for people because, I didn't realize I was making that face. People think I'm angry. I've got the downturn, the RBF. I mean, those are things that people come in with, fix my RBF. And so now, we're able to lift up, and sometimes it's actually starting off with lifting up a little bit of that lateral cheek that then allows for this to look much more natural and not full here, because we don't want you to look bulldog either. So like I said, these are all things that, with experience, and just understand the mechanics of anatomy and how people move. And when I like to have you smile and show me how you talk, and we have a conversation beforehand because I'm watching you, and it makes sense in each one of our corrections. Okay?
I want to skip a couple questions and I'll get back to them, but I like this one here. It's just very specific. Do I need to stop topical retinoids before the injections?
Not typically. I mean, your skin can be a little, your skin is very delicate.
Yes.
Right.
But certainly
anti-inflammatories that have people
Yes,
stop.
because of the bleeding issues, and what if, Accutane or other oral retinoids?
Right. Oral retinoids, I mean, typically we would like to have clearance from, whoever's prescribed it, typically a dermatologist, to see.
We're not seeing, very few people are on those anymore. But anyway, topical retinoids, you're good to go on that. And then a couple just repeated questions, but they're worth, obviously, I know you guys are kind of jumping in and out here. Does it last longer than other fillers? It's sort of yes, but yes, it does. 15 months is sort of what we're kind of saying with that.
And what's nice is because it's been in our practice for about a year now. That's not just a clinical studies type of number. It actually is something that we have found in our practice, which is why we felt comfortable, doing an event like this, introducing it, because anything that comes in, we vet it to where we want to make sure that we're standing behind it, and if we say that, then
I like this question too. Okay, we're going to keep going here. With a heavy jowl, would you recommend this product in the cheek to lift that? And I would say,
you can lift up some, if it's
depends on how heavy it is. Okay.
Depends on how great a jowl.
And certainly, there's a lot of factors, and you have to be examined, because if it's really heavy, it's going to take so much product to get it up that you're not going to benefit doing that. You need to get in and surgically lift that jowl. Okay. So you can get some lift. The degree of lift that you'll get with putting it above the jowl is proportionate to the amount that you get, and proportionate to the weight and severity of the jowl. So and that's where you want to get in earlier, before it becomes that heavy jowl, so that you can sort of temporize those things with the product.
Mm-hmm.
Right.
And that's part of it, is that once again, we do more of that lateral lifting that's there, but with fillers, there are some limitations to it, just like with anything. So it takes that pressure off of it.
Let me keep going here.
Let's see.
Can I swim in your pool? I don't know if you guys can see how it's really stormy here.
It is stormy. I'm going to sit lately we've had some.
Yes, you can come. Can it cause Tyndall effect? I mean, I think that's a little inside baseball stuff, where you can get a little bit of visibility of the product in the lower eyelid areas. That's why you have to be very, very careful when you do your eyelids, tear troughs. You need someone that knows what they're doing and has the experience. And Z, she's there. Okay. Tyndall effect is certainly not something we see in our, but certainly any product you put in your lower lids, you can get a little visibility, which would be considered part of that Tyndall effect. How long does it last? 15 months. Can this help with crooked smiles? And I think there was something else about, I would put this question also, I talked about hooded brows, things that are maybe more anatomically stagnant. Does this still work?
I mean, honestly, a part of that is depending on it all depends on the cause. I mean, if your smile is that way because of the little structural asymmetries or the way that your muscle pulls, then we're not going to change how that occurs. As far as the muscle will still pull in a certain direction, you'll still have some skeletal issues if that's the root cause of it. But we can camouflage it a little bit more by replacing some of that volume. People say all the time, I'm starting to get these smile lines, and we have 4 adorable children, and our super cute 9-year-old has nasolabial folds. I'm not taking him out anytime soon, just because that's a part of, it's part of his natural anatomy. And with that, when they were little and juicy, they had jowls too, because their structure, they had volume that wasn't well supported by their skeletal system. And so now, as they've gotten older, they're now they don't have as much of that baby fat, but they're being well supported. But as we get older, structurally, we lose some of that skeletal structure. So now if we're able to allow for deeper support, we're able to lift tissue up a little bit more for patients that are older. And then, allow also for specific areas of transition to look more natural. Your nasolabial folds don't have to be as deep, but we can just soften it. And that's when we do those power injections, like here at the lateral cheek, it brings that up, and also here at the piriform. So you saw this demonstrated.
Good. I'm going to cut you off.
Fine.
She can talk all night. All right. If we do filler, can we do facial laser treatment like Halo or Urban, for example?
Yes. So I always.
We're going to do everything.
Yes.
Let's say you're going to do facelift, fillers, and a laser. How would you sequence those three things? And I'll answer my own question here, because there's not a straightforward answer. You do like what bothers you the most, or what's going to get you the furthest. If is it the laser resurfacing, you do that first. If it's the anatomy, the jowls, the neck bands, you do the surgery first. If it's just the volume, lips, perioral area, maybe you do the fillers first. As far as doing lasers and fillers at the same time, I'll let Z answer that, but certainly you can sequence that in the same fashion. So if you're not going to do surgery, you're going to do laser or filler, or laser then filler. That's fine. You probably would want to wait a week after the laser to do the filler.
I do 2 weeks.
2 weeks
I mean,
is fine.
typically.
Depends on the depth of the laser.
So, I mean, in general, though, quite honestly, because the skin just is it's the curb appeal, right? And it allows for the quality of your result to be so much better. I mean, one of our before and afters that you saw was Julie. She was a blonde, and you can tell, so we actually did her skin resurfacing about a month or so beforehand, just from a timing standpoint. And it was great because you could really see that difference of her fillers, and everything looks so much more beautiful because we weren't distracted by hyperpigmentation, and we weren't distracted, and she didn't have any additional swelling. So the laser got to do its job, and the filler got to do its job, and it was this beautiful harmony. And so she has such a great result because of that. And the same thing with facelifts, is that if we're able to do the laser treatments beforehand, I think that people tend to, they have a nicer canvas to heal. The caveat is that sometimes with the incisions and everything, we can do some laser treatments afterwards to minimize some of the incisions too. So, just because you do one laser doesn't mean that you're one and done, because with everything in life, like I said, we're living and we're running parallel tracks. And so there's going to be some maintenance involved.
Oh man, a lot of Z is the best comments coming across. Thank you for that. Yes. A lot of questions about cost too. I know I kind of touched on that earlier, but I'd like you to talk a little bit about, just for a minute, about some of the promotions we're running tonight. And then if you want to talk again about the cost of the product per syringe.
So as far as the cost of the product, the syringe, once again, we are aligning this with more of our premium, our premium fillers, because they do have such a long duration, and also the type of correction that you're able to get. We have progressive savings essentially tonight, where, if you just get one syringe, so you just want to do the lips, you get $50 off. But if you get a second syringe, you get an additional $100 off. And then if you do a third syringe, you get another $200 off. And then another, it's $500 off. So essentially, at the end of the day,
the more you get, the more you save.
Right. The more you get, the more you save. And also, one of the other things that we're doing tonight actually is that if you wanted to do a screenshot and post about this event tonight and tag us on Instagram or Facebook, you are actually going to be getting a free skincare product. And then we're going to put all those names in a big raffle, so that someone's going to win a $300 TNS Essential Advanced Serum, which is worth over $300 by itself. So it's pretty awesome. And that's just, we're excited to bring this to you. And we appreciate you spending the night with us too. Additional promotions that we have are $50 off a salt facial, our Halo, which is one of our favorite lasers, that laser treatment that we do. If you book a Halo treatment, then you will get a free area of BBL, which can be valued up to $800 if you end up doing the chest area. And also, if you logged on right at the beginning at 6:30 and you stayed with us for the duration, with your RHA filler, I will actually do a free nano peel for you, which is, another $700.
I was here the whole time.
You were here the whole time, and I'm all about peeling some of that off.
My nano peel.
You get your nano peel on.
Sign me up. Thank you for that.
Yes, you're welcome. It's gonna feel so much off you right now.
Anything else
It is good.
anything you'd like to say in closing, Z? I would like to say thank you guys for coming with us again. I mean, it means a lot to have this many people here, this engaged on the question and everything. And if we didn't get your question, we'll try to text you later or talk to you next time we see you. Again, very, very appreciative. And Z did a wonderful job with this. She really prepared hard for this, put a lot of effort in this. And it's great for me. It's great for us as a couple. It's great for us as a family. So thanks for being here. And thank you to Z for putting this on.
And as a reminder also, you're going to be getting a text after this event tonight. And if you reply yes to it, then you will already be ready to go ahead and book your consult, and you take advantage of all these promotions tonight. So thank you again. We appreciate it from our house to yours. Even in this crazy rain that we're having, thankfully we didn't lose power or internet. So it all worked out for us tonight. All right. Thank you.
Enjoy the rest of your night.
Yep. All right.
See you soon.
Bye.
Bye.